We're back with Amir Jamali to talk about quality. Amir, here's the question. Here's the issue. Everybody wants quality. Nobody knows really how to define it, or at least let's just say that everybody has a different definition. In many cases, and there are public, there are online tools where people are measuring quality as defined by the number of parking spaces and how long you wait in the waiting room. Most surgeons would reject that as a definition of quality. Surgeons look at things like blood loss, perforations, infections, and things of that nature, not to mention success in surgery. Given that there are no objective tools for the kinds of things I just cited, there are no tools that would help us discriminate or say that you're a better surgeon than the guy down the street in terms of blood loss or infections or true clinical things. The question is, are there any other tools other than the objective ones? I want to reference with you a study that was done in Michigan. This was done by the Michigan Bariatric Collaborative, where they took videotapes of surgeons and gave them to other surgeons and asked them to score their colleagues. The observation was really interesting, and that is that when surgeons looked at their colleagues' work on videotape and gave them scores ranging from 1 to 5, those scores, those subjective scores, correlated beautifully with objectively measured clinical outcomes like readmissions, reoperations, duration of surgery. What is it about surgeons that allows them to know things subjectively and immediately that nobody else really does? And if you agree that this is a general phenomenon, I want you to talk about orthopedics and whether or not it applies there too.
Well, I do agree that surgeons we're always striving to do better. So I think we all see our own cases and have a repository of information about what has constituted a successful surgery, successful technical exercise. And also, as we have gotten more experience through our training, we've seen the evolution of our own skills. So I'm not surprised that surgeons looking at videos of bariatric surgery could tell which ones are going to be more likely to have had a good outcome. It may come to certain things such as the efficiency of the technical exercise of repairing certain structures in the bariatric surgery, or repeating the same steps, or simply the delicacy of the technical skills that the surgeon has had. So I'm not surprised by that at all. I think your second question was whether that would apply to orthopedics.
Yeah, I mean, more specifically, look, you've operated with other surgeons, okay? You've stepped in and watched them operate. Can you tell if they're a good surgeon just by looking at them? Can you tell if their patients are going to do generally well or not well by looking at them?
Yes, what I've realized is that there's a lot to the surgery, especially in orthopedic. We have a lot of dependence on equipment. So the first thing about a successful surgery is the thought process that got the patient and the surgeon to the operating room in the first place. So when the surgeon has done a lot of planning ahead of time, then almost everything usually goes well during the surgery. So there's a lot of brain power that's required prior to getting to the OR. As far as once you're there, then there's other things that also depend on the team, having a team that's integrated well with the surgeon. And that is another second part that's external to the skills of the surgeon. Now, if we put those things aside, there's definitely things that we see in our colleagues that reflect that they are thoughtful, they're delicate in the way they handle the tissues, they're delicate in the way they handle the power tools that we often have to use. They don't dig themselves holes that they have to dig themselves out of. Those are all things that are very, very quickly recognizable when you see a colleague, or if you were to look at a video of a surgery.
You know, one of the urologists we're working with said, and this is a guy who's taught surgeons from Korea to Brazil. I mean, he's taught probably a few hundred surgeons at this point in reconstructive urology. He said, I can tell a good surgeon within 2 minutes based on how he does his skin incision, and it goes from there. Does that make sense to you?
I would agree with that. I would even take it further, and I would say I could tell a good surgeon a lot of times from how they prep the patient. If you start contaminating before you've even prepped the patient, then I don't think the surgery is going to go very well.
Great. Thanks for your thoughts. Thank you very much.